Hello, my name is David Goodkind, a board-certified plastic surgeon since 1984 and the owner and director of FUZION Medical Aesthetic Boutique. This is one of the many videos I have created where I briefly describe the salient points of the cosmetic surgeries I perform. Consider it a quick introduction to the surgical procedure, a start to your education process. It will stimulate thought and questions. It should, by no means, be interpreted as a substitute for a complete in-office consultation. The video is a simple presentation without diagrams, pictures, or other visual aids. I would encourage anyone interested after watching to navigate through my website, FUZIONCT.com, look at the before and after examples of surgical and non-surgical procedures and the text, and then make an appointment for a complimentary, in-depth personal and private consultation. At that point, I and my team of aesthetic experts will be able to speak more specifically about your desires, your anatomy, and your expectations. We will then formulate a detailed plan personalized for you. I look forward to seeing you at FUZION in the very near future. Thank you very much. I'd like to talk to you now about an abdominoplasty. I guess it's fair to say that abdominoplasty is one of the biggest operations, aside from a trunk lift, but it's one of the biggest operations I do and probably has one of the fussiest recoveries. Unfortunately, sometimes as we age, we get lax muscles and skin, which causes abdominal fullness. After great weight loss, we have abdominal fullness and excess skin and fat. And after pregnancy, we're often left with redundant lax muscles and excess skin. Most husbands tell their wives to go to the gym and they should be able to eliminate this deformity. Unfortunately, that's not the case. Once the skin is stretched out, it's stretched out forever, and the patient either lives with it or decides to have surgery. There are 3 steps to an abdominoplasty. The first is me making a large curvilinear incision from hip to hip, just above your pubic bone, carrying that dissection down to the muscle level, and then elevating all of that skin and fat all the way up to the rib cage. You core around the belly button, let the belly button drop down onto the abdominal wall. The second step of the operation is to tighten the abdominal girdle, the abdominal muscles, from your breastbone to your pubic bone. This is done with several interrupted stitches, and what I do is tighten up your abdominal muscles so they're as tight as could be, eliminating a possible space called the diastasis recti between the muscles, and really shoring it up so that your abdominal cavity is as tight as possible. That's the second step. In the last step, we place you in the sitting position on the operating table, pull down on that big apron of skin that I just elevated, pull it down so that I can cut off all the excess skin. I usually cut off the excess skin somewhere at or above where the original belly button was. Tidy up that wound, put in some drains, close it up. Right before closing up, I'll make a little stab wound where the belly button is on the abdominal wall, pull it out, and attach it to the abdominal wall in its new place. The results in the proper patient are amazing. The results are a tighter, flatter, much more contoured and proportionate midsection. Then with the patient in this flex position, we put them in their hospital bed, keeping them flexed at the hips, and I always keep people overnight. It's an uncomfortable operation, and I tell everyone that they're 50% better patient the day after than the day of surgery. I never send anybody home whose abdominal wall I've tightened up. It's way too uncomfortable, and it's so much more easily tolerated by staying a night in the hospital with a pain pump so that you're absolutely pain-free. I see everybody the next day, make sure that there's no problems with the surgery. They're sent home, bent over, and it takes them about a week to 10 days to stand up straight. The uncomfortable part is the tightening of the muscle, and the second uncomfortable part is that since you're bent over, you're relying on your back muscles to keep you upright, and not your spine stacked on itself, so that it does cause some discomfort in your back. The trick to healing a tummy tuck is a balancing act between doing enough activity and doing too much activity. If you don't do enough activity, you can get clots in your legs that can be hugely problematic. If you do too much activity, you can create shearing between your abdominal wall and this abdominal flap that I've elevated. Your body's response to all of that shearing is fluid into that space, which will overwhelm the drain's ability to drain it out, and you'll have a problem with wound healing. It's very rare that anybody has a significant problem. I'm in constant communication with them for the first few days, making sure that their activity level is appropriate for the operation that I did and their height and weight and size. I've never had a patient tell me that it wasn't worth all the energy that they put into it. It results in a beautifully proportioned body, eliminating that heavy midsection roll and totally recontouring people so that they feel comfortable wearing dresses and pants and skirts and bathing suits. It is, after all is said and done, a big difference. I encourage you to look at some of the amazing results on my website, read the text, and come in for a personalized consultation so I can tell you exactly where in the scheme of things you lie and what I can do for you. Thank you.